In this video, I'm going to show you how this new blood test called MVX Plus flips medicine upside down. So first I need to explain some graphics. This one shows the 7-step blueprint to optimal health. This is a 7-step process I came up with over the course of 25 years to get sick people well. And the MVX Plus blood test measures all these steps. And I'm going to show you this graphic next. On the 7-step blueprint, I labeled the 6 factors of MVX and where they belong. I'm giving you this overview right now. We'll go into details later. Here's what the MVX test looks like when you get the results. There are 3 indices and 6 factors. The first 2 lines are 2 of the 3 indices. These don't actually target clinically. And then we have glycase, small acyl particle number, citrate, valine, leucine, and isoleucine. Those are the 6 factors that you can target clinically and make them better. So I put down where the 7 steps are when you talk about these 6 factors. So here we have glycase. It's in steps 3, 4, 5, and 7 of the 7 steps. The small acyl particle number, that's step 6. Citrate is step 2, and then the last step, O, for optimization. Then the last 3, valine, leucine, and isoleucine, they're in steps 1 and 2. Let's go back to this one. The first step is diet, foundational foods, and that's where you address the branched chain amino acids, the last 3 factors of MVX. Step 2 is increasing energy production in the mitochondria. That addresses the branched chain amino acids and citrate. Step 3 is drainage. That addresses glycase. So does step 4 and 5. That's cleaning out the colon and the rest of the body of organisms. Step 6 is small acyl particle number. That's detoxing. Step 7 is intracellular organisms such as Lyme disease. And then the last step, O, is citrate. This is a match made in heaven. It's a universal truth, MVX Plus, and the 7-step blueprint to optimal health. When you have truth, it's truthful everywhere. It's a universal truth. And we're measuring physiology, like how your body's working on the inside. It's not risk factors. It's not pathology. We're actually measuring how your body functions. If your body functions 100% correctly, what disease do you have? No disease. That's the idea. But if you have risk factors, does that cause disease? Not necessarily. And if you have pathology, can you treat that successfully? Not necessarily, because you have to go before that and actually get to the causes. So having said that, follow me along with this graphic that I made in 2017. I made this based on the information taught to us by the founders of medicine of the 1920s, 30s, and 40s. And what they said was you have to address the causes of chronic disease. And that's this blue circle right here. There are 3 major causes: toxins, pathogens, and excess sugar intake. You also have to address the most common mechanism of chronic disease, which is in the green circle. That's lactic acidosis. Now we know it as mitochondrial dysfunction. But in the 1930s, it was called lactic acidosis. The mitochondria are where your cells make energy, and each cell may have 2,000 up to 2 million mitochondria. The red circle, the last one, that's symptoms. The last circle is symptoms right here, this purple circle, and that's where organs need help, and when you feed the organs properly, symptoms go away. But you have to address all 3 of these circles in order to get true healing from chronic illness. Now, in medicine, when you go to them and you say, hey, I got the symptom, I got pain, I'm depressed, I got whatever symptom, they measure symptoms in their labs and they treat symptoms with their medications. And you talk about symptoms and they're hoping that your symptoms go away. But they don't really get into the mechanism and they don't get into causes. Now, MVX Plus is the most important lab test to measure the mechanism and causes. Check this out. Here are the 6 factors of MVX. We have citrate measuring mitochondrial dysfunction right here. Back in the 30s, they called it lactic acidosis. And then to the far left, we have small acyl particles. They measure toxins. And then above that, we have pathogens measured by glycase. These are the factors of MVX. And then the last one is the BCAAs. It says branched chain amino acids. And those measure your diet, excess sugar intake, B1 deficiency, and amino acid deficiency. So it's amazing how this one lab test measures the most important factors of physiology. And you can work on each one of these and improve them and then improve your overall score. And I've done this now for many people over the last several months since this lab was released at the beginning of 2025. Now we're measuring physiology, right? We're not measuring risk factors and we're not measuring pathology. Pathology is at the very end of your disease process. And risk factors may or may not cause any problems whatsoever. So we're measuring physiology. That's what's really important. Like deep inside, is your body working well? And if it is, then what disease do you have? no disease. That's the idea. And the physiology has been studied and discovered over the course of 100 years. I like to read old nutrition and medical textbooks. You can see behind my shoulder some examples of some of these books going back to 1929 and earlier. And here's another pile of them. Don't forget to read books. The internet doesn't have all the answers. I can tell when doctors only read PubMed because they have tunnel vision. They don't know their history very well. So I've had a few new patients tell me, hey, I don't want to work with you because I don't think your diagnosis is correct. And my answer is, it's not about a diagnosis. I've even heard alternative holistic doctors say, get the diagnosis. And it's not really about that, unfortunately. I wish it was, because then it'd be really simple. But the truth is, most people with chronic illness have multiple factors going on. And you start with the worst one. So you look at the MVX scores and you see which one this person needs to really work on first. You address that, make it better. Then you have to pivot to the next worst problem. So there's the 7-step blueprint to optimal health. I line it up here in the red font with the 6 factors of MVX. And then somebody may need to detox first, then get rid of infections and inflammation, fix up their diet, eat more protein, digest protein better, fix up their mitochondria. There's all these factors. So which one do you need to focus on first? And then second. And so you're pivoting from one quote unquote diagnosis to the next.
Here we go. Pivot. 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 It doesn't go on this thing.
Another factor is specialists. You can have a Lyme specialist, you can have a parasite specialist, and they're going to be part of the 7-step blueprint to optimal health. Lyme specialist at step 7, the parasite specialist at steps 4 and 5. But in medicine, they don't have those kind of specialists like in the holistic fields. They have liver specialists, they have skin specialists. So the specialties are in the type of infection or the organ that the problem is in. So that doesn't really match up with fixing physiology. You fix physiology by detoxing and then nourishing. You don't fix physiology by drugging the liver or by putting something topical on the skin. So this is how medicine gets flipped upside down, because we're addressing how the body functions as opposed to treating symptoms, discussing, discovering, testing, and treating symptoms. We're going before that. Your job as a patient is to talk about the symptoms in the red circle, and then the doctor talks about mechanisms and causes. So they acknowledge your symptoms, but they're not necessarily going after your symptoms, treating them. And guess what? And they're very visible too. You can see the symptoms, you can feel the symptoms, but the mechanisms and causes, they can be invisible. So they're easy to miss. But now with MVX, we can find the mechanisms and the causes. And now they become more and more visible. So this is where most of the discussion should be at, with the green and the blue, as the doctors and patients are discussing, what to do next. Then you're using symptoms to track progress. You're not using symptoms as the enemy. Of course, you want your symptoms to go away, and you can feed organs to make them go away. But you got to address all 3 things. You can't just address the red circle. If you want to run MVX Plus on yourself, you go to the front page of my website, upper right corner, click on MVX Test, and get your score. If you're a doctor and you want to learn how to run MVX Plus, interpret it, and use it to guide, track, and measure progress with yourself and your patients, I'm setting up trainings, and you can send an email to this address.